I'm a registered dietitian.
I'm an exercise physiologist.
I'm a cardiologist.
I'm a clinical pharmacy coordinator.
I'm living with heart disease every day.
And I live with coronary artery disease.
Basically, there are many different types of warning signs for a heart attack. Some are more obvious than others. We all hear and study about chest pain and chest discomfort. Interestingly, over 40% of women don't have any sort of chest discomfort. What they do typically experience is shortness of breath. Any sort of a sensation that they can't get enough air in their lungs is what we mean by that. If they can't carry on a conversation without gasping for air, that's also another sign of being short of breath. Dizziness is another symptom that is very common, either at rest or when they're walking around. A feeling that their heart is racing or palpitations is seen pretty often. The sensation of unusual fatigue is something that they describe to us very eloquently. They will be carrying on with certain activities and then just feel exhausted, which is not typical for them. If you find that you're having any of these symptoms and you're concerned that you're having a heart attack, the first thing to do is to chew an aspirin. Call 911 right away. We have had examples of people trying to drive themselves, and it doesn't work out very well. So safest route, call 911. They'll get you to the right hospital at the right time. We know that the sooner you get to a hospital and are evaluated, the better you do. The heart, like the brain, needs oxygen immediately. You can't hold off. Heart cells begin to die right away. So the quicker you get to the hospital, the better chance you have. The smaller your heart attack will be, and the better you'll do after your heart attack. Why don't women have the typical symptoms that men do? Well, typically they have smaller arteries. We're learning more and more through a lot of our different testing modalities that the process of building plaque in their arteries may be different and distributed differently. For example, diabetic women tend to have a large plaque burden that's more spread out in their arteries, whereas men tend to have more discrete or focal lesions. And perhaps that has something to do with the difference in their symptoms. I think women know their bodies the best. So while doing any sort of activities, if they start to notice any of these symptoms that we've talked about, particularly shortness of breath or dizziness, fatigue, they should have a high level of suspicion. There's certain ingredients for a heart attack that many people know about, but just to review them, family history is very important. So if you have anyone in your family who, particularly first-generation family member who's had heart disease at a young age, that places you at a higher risk. Smoking, which unfortunately is becoming more and more common in women, is the number one preventable risk factor for heart disease. So if you smoke and your father had a heart attack when he was 50, that puts you in a higher risk category. For women, diabetes is becoming a big problem. It's underdiagnosed, and it creates a lot of difficulties with treatment, as I alluded to before. The other risk factors to know about are high blood pressure. 9 out of 10 women over age 55 will develop hypertension, and 1 in 3 women don't know that they have high blood pressure. So a lot of this, you'll see a theme, and it's under recognition, both on the part of the women going through this and the caregivers, so family members and then the medical team. So you've been through a lot. To keep yourself healthy, we suggest you see your cardiologist at least once a year and keep exercising and follow a heart-healthy diet. My name is Shalini Bobra, and I'm a cardiologist at the Minneapolis Heart Institute.